This presentation is a brief overview of the book chapter, Dementia and Vocally Disruptive Behaviour. What motivates vocally disruptive behaviour by people living with dementia, and how can it be managed? Dementia is a progressive degenerative disease of the brain resulting in abnormal mental processing and cognition. As degeneration begins to worsen, the impact of the disease becomes more pronounced and disabling, impairing functions such as memory retention and retrieval, thinking, and everyday behaviours. This is Grace, a 79-year-old woman with moderate to severe progression of dementia. Grace has recently been put into a care facility because her family can no longer look after her, as she has begun to display, common in dementia patients, vocally disruptive behaviours. Some of her vocally disruptive behaviours include screaming, humming, moaning, excessive talking and making noises, inappropriate requests, yelling, abuse, and repetition of the same few words. Often her family or medical professionals are unable to ascertain the reason for her verbally disruptive behaviour, as her ability to communicate effectively has declined. In order to help Grace, it is important to understand what could be motivating these verbally disruptive behaviours. Physical needs, which are basic innate needs such as hunger, thirst, pain, and wanting to use the toilet. Environmental factors such as loud noise, changing of carers, inadequate or overstimulation, and having too many people around them. Operant conditioning, the response to verbally disruptive behaviour is followed by an intermittent reinforcement schedule, which has been suggested to produce behaviours harder to extinguish. And psychological distress. The negative consequences of verbally disruptive behaviour include anxiety and distress. Recurrent vocalizations can lead to social isolation, resulting in feelings of helplessness and a sense of being lost. When thinking about Grace's verbally disruptive behaviour, keep in mind two theories of motivation that may help explain why this behaviour occurs. Drive reduction theory, which suggests that individuals are motivated or driven to reduce basic needs such as feelings of hunger and thirst. Responses are said to increase until the need is satisfied. The second being Maslow's hierarchy of needs, which suggests the levels of the hierarchy may begin to explain verbally disruptive behaviour in people with dementia. In relation to basic needs, respect, privacy, and issues around social isolation. Theory and research has suggested that some possible ways to manage Grace's verbally disruptive behaviour include pharmacological interventions, the psychosocial structural model, which involves educating caregivers about the disease and employing a person-centered approach, improving the way a caregiver responds to the disturbance. Reducing social isolation, respecting her autonomy, and musical interventions. This was a brief overview. For further information, please see the book chapter and following references.
Created using Powtoon.